Okay, a little bit more behind Employer's Choice. So Employer's Choice is the brand name of our plan, EHP Employer's Choice. Our provider, this is significant as well, is Revive Health. Okay, benefit
Mm.
of this, significance of this is twofold. Obviously, it doesn't. Employers don't necessarily feel comfortable if they find out the company running the show is a startup or something, or underfunded or something of that nature. We are quite the opposite. Revive's been in business 18 years, has over 4 million members on our platform, very recognizable names. This also is significant for HR. When HR, is going to trust somebody else to hand the reins over to take care of their employees from an admin perspective, they want to know their employees are in good hands. Couldn't be better. Now, the other significance is when we talk about the benefits, which we're going to do that real quick. So you kind of have an idea, well, what is this? You keep talking about the value of these benefits. What is that? So let's touch on that real quick. Um, so let's do that, and then I'll tie this in. But the other significance I was going to say, everything we offer in our benefit plan, first off, HR friendly. We say that a lot. It's not lip service. We mean it sincerely. We won't become a dirty word in the HR department. That's one of our massive advantages. But part of the reason for that, everything's proprietary. Everything we offer on the wellness side, the preventative care side, anything in our benefit plan is proprietary. It all goes through Revive Health. We don't white label and third party outsource any of it. So when it comes to employee usability, super, super friendly. Our technology is kindergarten easy to use the benefits. That's not that cannot be said of most of our competitors. Most of our competitors have anywhere between 3 to 6 vendors they're
Hmm.
utilizing to put their package of benefits together, and they white label it, and it makes usability for employees a nightmare. So we just had a big tech company out of Texas, switch over to us. It was for that reason. Their employees couldn't figure out who to call for what. Even the HR manager, she couldn't figure out who to call to get help, guidance to help her employees. They just couldn't use it. It was a nightmare. We don't have that issue. Okay, so real quick, what is this, right? Okay, so our benefit package, remember, all inclusive. So once we determine eligibility, which we do through a simple payroll analysis, I'll touch on that when we go get the payroll. I want you to kind of give you an idea what the numbers look like typically for an employer based on W-2 full time, and having a healthcare plan. Now,
Hmm.
a sidebar on that. Again, here's where we start talking about massive added value potentially. We can add up to 6 dependents at no additional cost, at no cost for the employee. So when we're talking to employers who their workforce is between that 35 to $75,000 income or $65,000 income, it's not uncommon for those employees to have employee only healthcare, right? Because it's too expensive for them to insure their whole family, or they have
Hmm.
very limited coverage for their family with massive deductibles and whatnot, right? So when we start talking about we can add 5 or 6 dependents up to on our plan at no cost to the employer, now we're talking value add that's off the charts, right? And that's really where this is where we're going to get real traction with employers when they start seeing, oh wow, this plan offers a lot to our employees. This is incredible. Oh, by the way, here's these cool tax incentives.